Okay, so this is a short video on the magnesium sulfate. You may have used this magnesium sulfate often or have learned about it. Let's take a look at it really briefly in what disease condition we use this magnesium sulfate. First of all is to treat torsade de pois. I know it's kind of like people say it differently. I said torsade de pois. This is one of the lethal cardiac arrhythmia, I would say, because I used the lethal word because you do not want your patient in this cardiac arrhythmia for longer. You want to treat them as soon as possible. It's just like code blue. And this is often caused by the low magnesium level. So in order to treat this cardiac arrhythmia, we often use the magnesium sulfate bolus during the emergency condition, and then probably magnesium sulfate IV bags. The other use for this one is to control seizures in pregnant women and for the treatments of preeclampsia in pregnant women. Preeclampsia is basically pre-hypertension. To treat the low magnesium level, the normal level is 1.5 to 2.5 milliequivalent per liter, and also to maintain the proper level of magnesium in patients who are receiving TPN. You often, like in TPN, you don't get enough magnesium, and there is a high chance you get rid of magnesium really fast. So it's to maintain the proper level of magnesium. They often prescribe magnesium supplement when the patient's already on TPN. What are the side effects and contraindications? The side effects and contraindications basically the signs and symptoms of hypermagnesiemia, because if you give it too much, it will cause hypermagnesemia, and that will cause the low blood pressure. It will cause the confusion, obviously irregular heartbeat. It will cause the dizziness, muscle weakness. Now, the magnesiums also are important in the respiratory system as well. It can cause the respiratory arrest, but it has to be really, really, really low in order to cause this respiratory arrest, and it's really rare. It causes the diarrhea and increase in bleeding time. So patient will bleed more, and it will take more time to clot the blood. So you want to be really looking for the side effects of magnesium sulfate, but remember, these side effects are really rare, and you'll see these side effects like if the normal level of magnesium is 1.5 to 2.5, you'll probably see these side effects when the level goes above 3. So this is a brief video about the magnesium sulfate. If you have any questions about the magnesium sulfate, feel free to ask us or email us anytime, and thanks for watching.